Welcome back to Senior Care Matters. I'm your host, Dana Arnone, and we're here for part 2 of my conversation with Stu from Gurwin Healthcare System. So continuing on our other conversation, because there's just so much on Gurwin that I think people would be interested to know about. I want to go back to the community type of relationships that you guys have and the things that you do in the community. So let's talk about that. So what type of community things are you looking to do?
So first of all, we have a great relationship with many of our neighbors along Comac Road. It's a very unique relationship. There is an autism center on this road. There is the Suffolk YJCC right next to us. We have the Comac Library, the Hamlet across the street. So we have a very, very good local network of providers and community resources that we make available to all of our residents, and we help each other should we ever need it. So whether it's leasing space from one to the other, whether it's hosting events here, the library was under major renovation a few years ago. We housed their programs here. So we have many, many relationships. But on an internal level, individuals can come and volunteer here. We have a very healthy volunteer program. Individuals can help in many, many ways. Even just as a companion with a resident goes such a long way to people who maybe don't have family nearby. Yeah. But we have groups who come here from schools, from synagogues, from churches. They want to sing for residents. They want to perform. This happens all the time here. We also put on continuing education programs. This is something new for specialists. They're critical because if they know what services we're offering here in our system, they can help educate the public as to what is here at Gurwin. Yeah. And anytime we do this, people learn. Elder law is a perfect example. Many individuals who come here, they haven't planned to come here, but now they're in here, and they need elder care advisement. So we now have an education program, again for credits, for the elder law attorneys. They come here, they get their credits. They also get to experience Gurwin. Maybe they haven't physically been here before. We get to introduce them to our team. So all these relationships really matter in developing a successful continuum of care. And I'm very proud that we've developed something very special here. Again, as a nonprofit, again, as a community leader. People look to us as the leader for healthcare in this industry. One other thing you may not know about me, I'm very active politically, and so I spend a lot of my time advocating for all of us, because although things are going well here for us at Gurwin, many of our colleagues, especially in hard-to-reach areas, many upstate counties, are really challenged and suffering, and they need support. So we're all in this together. It's not just for any one organization. So I'm a big believer in developing that network, and selfishly, it's been very good for us.
Yeah, I think it's so important when you're the leader to really believe what what you stand for, because I say that for myself as well. I'm a very big advocate for home care. I'm even a bigger advocate for the home care worker because of the job that they do. So I know that when people are coming to us looking for care, their families are looking for care, they know that I actually do believe everything that I say. And I think that comes through. And same thing for you.
Yeah. So I'm glad you mentioned that, because during the COVID period was a very tough time for long-term care facilities. I was not afraid.
Home care too.
I was a big advocate for all that we do. I spoke out very clearly of the need that we had to be supported better during very, very difficult times. We were, to the large part, maybe unfairly labeled as an industry, and take it very seriously. We take care of human beings. We do a great job of taking care of people as a whole, and we don't get enough credit for all that we do. Yeah. So I did this without anyone's blessing. I felt this was important to do. I've spoken to all the media outlets. I enjoy doing it, but it gives us an opportunity to get the right message out. We have just the most wonderful, facilities here. We do so much good for the community, and we got to be able to get the credit for that we do.
Yeah, no, I think that Gurwin, you offer a lot of options for people. One of the other things I just wanted to touch upon before we go take our tour is you also have vent units here and dialysis. So someone who is here on a subacute stay can go to, if they need dialysis, even upon discharge, that they can come back to the dialysis center. And I think that's important for people to know as well, that you do offer those different those are skilled services that not every subacute facility or long-term care facility offers.
I'm glad you mentioned that, because that really makes us more of a complex care provider. Yeah. because you wouldn't see those things, those services in other places, and we have all of it. So it allows us to take a more unstable, a more complex patient from the hospital. So the hospitals like us because they know
discharge.
They can do
Yeah,
a safe handoff.
Yeah.
One other thing, if you're a resident here in the center, we have all clinics available to residents who are here. So for example, if someone needs to see an orthopedist or podiatry, have an x-ray, be in the speech and hearing booth, whatever those services are, dentistry, they're available on an emergency basis or on a priority basis based upon their needs.
Mm-hmm. And you were mentioning before that you have an on-site pharmacy here as well?
Correct.
Yeah.
And our pharmacy, what we've done here is also very special. Virtually no nursing homes have pharmacies or have pharmacies anymore. We not only maintained our pharmacy, we have grown our pharmacy. So our pharmacy now services all of our buildings, whether you're in the nursing home, the assisted living facility, independent living, our island facility out east, and even better, because we care so much and do so much for our staff, we can have our own staff prescriptions filled by our pharmacy. So if I want my medications to be handled by our pharmacy, they'll do it for us.
That's very good.
And we promote that. We want to be able to do as much as we can for our staff. They're taking care of the residents, but I'm proud of what our pharmacy's been able to accomplish in terms of expanding care. And these are things that set us apart. These are things that are making us stay viable as a nonprofit during very, very turbulent times.
Yeah, and it makes it easy for the families. I think that people, when you're entering into the system of needing care, it is a very overwhelming system. People get lost in just the phone calls of figuring things out. So I think that it's important if they can go to one place and know that all services, including medicines or pharmacy, can be handled in one place. I think that's so important. It takes a lot of the stress and the burdens off the family, because I know that I'm in the industry and it's overwhelming for me. So I can't imagine someone that never did this before. And now they're dealing with somebody that's an emergency situation that they're looking for placement or looking for help or direction. So I think it's just so smart.
I mean, I'm in the industry and I might have more access or more information than others have, but I've been on that side and I understand when you're needy, when you're anxious and you need supports, who do I turn to, where do I get them? Yeah. Because like anyone else, I'm the family member too. I understand that. And so it's good. It helps put things in perspective if we can see ourselves as the families in the situation that they're in. We get calls from most people. Most people don't plan for this.
No, and they don't want it.
Yeah. So my mantra is very often, don't plan when you're in a crisis. Plan when things are relatively calm and stable. You'll be grateful that you did make those decisions. And again, I've been there on both sides. I understand it. But we've got to make sure that we educate our consumers so they understand it too. Very
good. Well, I hope this is the start of educating people in the community about Gurwin. And now we're going to take them on a little tour of the other buildings that you have here and just I'd like to show people what it actually looks like. I think it's very helpful for them to understand.
Thanks, Dana. Look forward to the tour.
Okay, very good. We'll be right back.
Every day, home health aides travel miles across our city to care for seniors who depend on them. But too often, long commutes and poor transportation keep them from reaching those who need the most. At All Things Home Care, we're changing that. By providing subsidized rides, we take the burden off caregivers so they can focus on care, not the commute. Because when caregivers are treated with dignity and respect, our seniors stay safe, cared for, and never alone. Join us in supporting the people who care for our loved ones. Learn more at allthingshomecare.org.
Body by Peter offers a premier at-home concierge service specializing in empathetic lymphatic massage and blood circulation enhancement. We provide a range of therapies, including red light therapy, wood therapy, body sculpting, and lymphatic detoxification. Our professional and compassionate approach ensures a rejuvenating experience in the comfort of clients' homes. Servicing Manhattan, Queens, and Long Island, New York. Call today, 516-509-3825.
At Reliance Home Senior Services, we believe every day shines brighter at home. As a licensed New York State-based agency owned and operated by a registered nurse, Reliance brings over 20 years of experience and personalized care right to your door. Our certified personal care and home health aides assist with bathing, grooming, dressing, medication reminders, light exercise routines, and to accompany you to appointments, all while offering companionship and a safe, caring presence. Need help navigating Medicaid? We're here for you. Our team of registered nurses and social workers offers in-home geriatric management, so both you and your family can breathe easier. And with 24/7 on-call support, bonded and insured aides, and a custom plan of care crafted just for you, we bring peace of mind right into your living room. Reliance Home Senior Services, bringing comfort, independence, and trust home.
Hi, welcome to Senior Care Matters. I'm your host, Dana Arnone, and I'm back with Stu. And we're going to be taking a tour today of Gurwin Rehab and Nursing Facility here in Commack, New York. So, Stu, I really am excited to see everything that you guys got going on here because it's like a whirlwind. So, tell us a little bit about the facility, how long it's been here, and exactly what you guys do here.
So this is a very special place. A lot of activities going on here. This is really the core of where Gurwin began in the late 1980s. So we're in a facility that was built over about a decade and a half, serving 460 residents, 120 of which are here for short-term rehabilitation. So really the meat and potatoes of what we do are taking folks from the hospital who need rehab, stabilizing them, and hopefully getting them home. So rehab is a very key component of what we do here. And even those residents who live here on a permanent basis, many of them also benefit by receiving rehabilitation. So rehab really is what we mostly do.
Great, and so then maybe we'll start there. We'll go take a tour of the rehab unit, show everybody what it looks like. Okay, so Sue, this is your subacute side of the building, right? So this is 120 subacute beds.
Yes, we refer to it as our Shackney Pavilion.
Shackney Pavilion, okay.
So most of the folks here are here for rehab. What's convenient is that it's on the main level of our building.
Okay.
And the rehab gyms where folks get their rehab services, it's convenient and it's local. So we don't have to deal as much with elevators. Transport is easy to locate them and bring them back. Everything we do, we try to do for convenience of the residents.
So let's talk about, so at a subacute stay here, are they getting physical therapy, occupational therapy? What does a normal subacute day look like for a patient?
Sure. So anyone who's here would receive physical therapy and occupational therapy each day if they're on rehab. So they might have physical therapy in the morning, they could have another session in the afternoon, or it might be an occupational therapy session. We do offer services if they need it 6 and 7 days a week. Not every facility is structured to do that, but we can offer that. Okay. Our goal is to get everyone home as quickly and as well as we can.
Yeah, up and going. So I know when we were talking the other day that we were talking about the different types of programs that you offer here. So you have on-site dialysis. Is that something that a subacute patient would be, if they needed it, they can get that as well?
They could. Dialysis is important because if someone's coming here for rehab, or even not for rehab, but they happen to be on dialysis, they can continue their treatment here without having to go out and come here.
Very helpful. And you also have vent units here too, so if someone is in need of a vent, they can come here as well, because that's very unusual.
Yeah, we're a complex care provider.
Yes, I can tell.
And you'll see that, certainly as we walk around. Okay. So ventilator care, dialysis, and subacute needs, stabilize them, and again, the goal to get them home.
Yeah. Okay, so Stu, we're in your rehab department now, so this is where they do physical therapy and occupational therapy throughout the day?
Correct. This is where all the activity happens.
This is one
happens. Action happens. One of two gyms that we have.
Oh, good, nice.
So if we're going to rehab as many people as I mentioned, over 100 people per day, we need the space, services, and equipment in order to do that. And so we have it here.
So can we go over and look at the car?
We can look at the car.
Yeah.
So we're looking at a classic Volvo. Folks often ask when they tour, why do you have a car in the gym? And it's not an obvious answer, but actually one of the very first things that a resident needs to be able to learn or relearn when they leave on rehab is to get in the car to go home.
Yeah, very important, yeah.
So this way we can instruct them, getting in, getting out. It's so important to do this well, because what we don't want is for someone to go home and then end up back in the hospital. So we have to work very hard to make it seamless, get them home so they don't have to come back. Yeah,
I think having a full car, that's very smart, very good. Okay, Stu, so now we're in your clinic area here at Gurwin. So let's talk about the different clinics that you guys offer. And are they offered to the subacute patients and long-term, or how does this work?
So this is a very key area for us because we've invested in having clinics with the goal of keeping our residents in-house should they have needs. And again, like dialysis, not having to send folks out for services. So for example, if someone needs an ophthalmology visit, podiatry visit, an orthopedic consult. That's all done here. We have a speech and hearing booth. We have our own imaging that can be done down here as well, and mobile in the building. It is primarily for the long-term care residents who live here, so they don't have to go out. If someone's here on short-term rehab and they have an acute need, an eye infection, we'll of course see them here in the eye clinic.
So can we just take a look at like maybe one of the rooms?
Happy to show you.
Very good, let's go. Okay, so now we're in their pharmacy, which is very unusual for a nursing home to have a full pharmacy with fully staffed. So why don't we talk a little bit about exactly what the pharmacy does here and who is benefiting from the pharmacy?
So virtually all nursing homes outsource the pharmacy services to a commercial pharmacy. We're unique in that we developed it in-house, but over the last year or two, we've taken it to a different level, meaning we now service the pharmaceutical needs in all of our buildings. So whether someone is next door in our assisted living facility, even at Fountain Gate, our independent living community, our facility out east in Holtzville, we're servicing. In addition, our employees, if they want to renew their meds, can be done here as well. So we've really taken this to a whole different level. We have
All you need is a dry cleaner in here and you guys are set. So where to next?
adult daycare.
Very good, let's go. Great. Okay, Stu, now we're in your social model daycare here on the grounds of Gurwin, which I really think is so important to show people because it's very unusual for a nursing facility to have, well, I guess it's not unusual for Gurwin, but you know, to have a social model daycare and a medical model daycare on the ground. So let's talk a little bit about the differences between the two programs that you offer here. So here's social model.
Correct, and what this does is it offers an opportunity for respite for either a family member or a resident who needs a safe place to be with socialization. So someone could come here, it's a flexible drop-off program. Someone could be here just for 2 hours, 3 hours, or for the whole day. And it's really just socialization. This way someone is not home feeling isolated or being isolated.
Right. So how many days is the program available to people?
So this flexible program is open 5 days a week, so it's a Monday to Friday program.
Very good.
And most of the individuals who come here for services have Alzheimer's or dementia. And therefore the engagement is very important for them here.
Yeah, they're doing art class right now. I think it's beautiful. It's beautifully set up. They did a great job. Very nice. Let's go see the medical daycare now.
Okay.
Okay, very good. So Stu, now we're in your medical model day program. So let's talk about the program itself here at the medical model. So what type of patients do you typically see here, and who's the payer source? And just tell me a little bit about it.
So as a medical model adult daycare program, the program is funded by Medicaid. We have close to 100 clients coming per day, and that includes transportation to get here. So if someone needs to see a nurse while they're here for medication management, as an example, or if they need rehab, we have a rehab gym here as well. If they need to see a social worker, a dietitian, all those services are built into the program. Hey guys, how are you?
Hello. I guess this is exercise time. This is great.
Amazing.
Hello.
Yeah.
How are you?
I'm great, Stu.
Great to see you.
Good to see you.
I get a proper greeting? Come on, I mean, I come down here for a greeting.
Oh, my Stu. Oh, my God. This is my CEO.
Okay, so Stu, we're here now talking to two of your lovely residents here. This is Doris and Joan. And Doris, I heard that you're president of the resident council.
That's right.
So what does that mean?
I open up all the meetings with a gavel
With a gavel
that my son got me.
that your son got you.
Yes.
So how long have you been here at Gurwin?
3.5 years.
And how do you like it?
I love it. I picked it to be here,
Okay.
and I love the care, the attention, the cleanliness. This is the cleanest place I've ever seen
actually
in my
true.
life.
Yes.
It shines.
Very nice. And I also heard you were talking before that you're rounding 100 years old.
Oh, I'll be 100 next year.
Next year. Very
Yeah,
good.
right.
That's nice. Well, thank you for spending some time with us.
Thank you.
So, Joan, you're a resident here as well, right?
Yes.
Yeah. So how long have you been here?
A little over 5 years.
And so
And
what
this-
is it? What's your favorite thing about Gurwin?
My favorite thing is that they have wonderful, wonderful people on the staff.
That's very important.
I've always told them one thing. You all have families, children. You have so many outside interests besides taking care of us. And you're doing a wonderful job, and I appreciate it.
I think a lot of people don't say that enough. I'm going to cry. I'm going to cry. That's beautiful.
Thank you. I appreciate you coming.
Yeah, thank you. Thank you for talking to us.
My pleasure.
Very good.
This is our synagogue that we renovated a few years back, where individuals can come and pray. It's a reflective place, but we serve all. We are multi-denominational, and we're very proud of that. Our staff, our residents, but again, just a lovely spiritual place where people can reflect. So right here, we're looking at one of our 2 donor boards for those folks who fortunately were very kind and contributed monies to us to help build this beautiful place. And it's got the rainbow theme, which you'll see our Simon Rainbow Room, but currently it's under major renovation, but we'll show it to you.
So now, Stu, we're inside the actual Rainbow Room where you're going to hold your therapeutic recreation. So let's talk about a little bit of what's going to be going on in here.
So the Simon family, which is very close to us for many years in supporting Gurwin, developed the Simon Rainbow Room here many years ago. Right now it's under renovation, so it's bright and white. But we will be keeping the rainbow theme. It's very important to really honor and acknowledge all the support that that family gave to us, the Simon family. Mm-hmm. So it will be redesigned, it will be beautiful, but again, for staff, for residents, for outside guests, and even behind us, some of the old tiles are here that we're going to retain and put up on one of the walls, again, out of respect for the family that has so well supported us, really over decades.
Yeah, really nice. It's going to be a great space. Looking forward to coming back when it's done.
We'll have you back.
Very good, thank you.
So here I'm in front of one of our classrooms. We take education very, very seriously here to have the best trained staff of all. So again, one of our classrooms, I'm happy to show it to you. And here we are. It's a nice flexible room that allows us to work and train staff.
So Stu, where are we heading right now?
Going up to the 4th floor,
okay,
where our ventilator unit is. It's nice to have little patios so someone can, if we can manage them outside, can go outside.
Very nice. Okay, so Stu, we're on the vent unit right now. So why don't we talk a little bit about, what does a typical patient look like?
So the residents who are here in this unit, it's very complex care needs that they have, mm-hmm. and everyone's different. So most individuals are coming to us from the hospital and need ventilator care, or they've come already on a ventilator, and we manage them here. The goal is to wean someone off of the ventilator. Many folks might stay here and live their lives and maybe be transferred to another floor, another area for long-term care needs. Some folks are here for short-term rehab and on ventilator as well. So it varies quite a bit.
I think the most important thing is that people know that any need that somebody would have can be handled here at Gurwin. From the highest of acuity of a patient where maybe their families were concerned about it going from nursing home to nursing home, if their needs change, you can basically handle most anything here. And I think that's the thing that we should get out the message mostly, is that anything that someone may be coming across, that they can handle it all here at Gurwin. They don't have to transfer from nursing home to nursing home just to get their needs met.
And that's a good point, because anytime we've added a program or service or built a building, mm-hmm. It's always been important for us to stay within our mission. And this clearly meets our mission, taking care of folks with a critical need. And the hospitals, they appreciate it, because not too many facilities have made this investment in resources, in effort. This is critical nursing care that's provided up here. Respiratory therapists are here 24/7. Mm-hmm. This is very specialized care and fits in, again, beautifully with our mission.
So Stu, we're here with Delta, who is the Director of Respiratory Therapy here at Gurwin. Correct. And we're looking at the ventilator that we were talking about before. It's called the Voxen.
The Voxen.
So why don't you tell us a little bit about it?
So the Voxen ventilator, we have the ventilator mode, which gives tidal volume, it gives a respiratory rate, and it gives a FiO2. And we're allowed to have the patient breathe when they're not able to sustain their own ventilation, right? So we use that for that purpose. And we also have a oxygen that we have to give because they're not able to breathe at room air. So we give them the oxygen for that. And we also have the cough assist therapy, which gives, it mobilizes secretions because they're not able to breathe on their own. So we do that. And then we also have suctioning, which we have the ability to suction our residents also. And we can give nebulizer treatments. So it's a all-inclusive ventilator.
So Stu, we're looking at some of the pictures here of some of the residents that actually that were trait and were on a vent and were able to go to a baseball game. So why don't we talk about, exactly what's going on in the picture here, because it's amazing.
So when we acquired our latest technology of ventilators called FACHE, the company was really wonderful in working with us to give an opportunity for us to take residents to a Met game.
Yeah, that's amazing.
And was very special because the ability to get anyone outside is challenging if you're on a vent. Our ventilators are basically mobile, so they allow someone to be able to move around more freely than a traditional ventilator.
So Stu, we're here now in the assisted living portion of Gurwin's compound, as I think that people are going to realize that there's really so many different buildings and so many different opportunities for people here. So let's talk a little bit about where we are right now. We're in the synagogue here in the assisted living.
Yes, so this is a key component of our continuum of care. Our assisted living facility is called FACHE Residences. It's comprised of 210 apartments, and in fact, we built 18 studios we completed a couple of years ago from within. And I want to highlight that because we found an opportunity to offer assisted living at a more affordable price by having studio apartments.
That's great.
So that's been very, very well received.
Thank you so much for taking me on this tour. I've learned so much about Gurwin and all the different programs that you guys offer. So if someone's interested in coming to Gurwin to visit or to tour or to just look at all the different options that you have, what's the best way that they can do that?
Sure, the best way would be really to go on our website. It's very user-friendly, www.gurwin.org.
And what would you want people to take away from our two-part series on Gurwin right now? What is it that you want people to understand?
I think what stands out when you compare us to others is that we've got this plethora of services. Everything is here, even beyond the life plan community. I don't know if we spoke about even home care. There's just so much to offer here. Healthcare really is our trademark, our legacy, and that stays close with us as we further develop Gurwin.
Yeah, very good. Well, I'm very impressed and I'm very happy to be able to be a part of it.
Thank you, Dana.
Very
Great
nice.
seeing you again.
Very good. This is Senior Care Matters. I'm your host, Dana Arnone, and we'll see you next time.